on this image, they did a very nice segmentation and isolation of the internal jugular vein.
Okay.
Actually, they started from the sigmoid sinus all the way to the jugular bulb, and then all the jugular. So you can see it's very beautifully shown that the internal jugular vein here at the level of C1 is displaced and compressed by the C1 tubercle.
Okay.
The same thing on the other side. Okay. So the same thing on the other side is basically bilateral significant internal jugular vein compression.
Okay.
And if we look to the side images, 3D side images, we can see a very extensive network of collaterals here. You can see, I mean, at some point the collaterals are actually bigger than the jugular vein itself, which also indicates that the jugular vein is compressed here. That's why the blood has hard time passing through. So it has to go somewhere. So it goes through these collaterals. And overall, it's a very nice CT angiogram. It looks like that the people who did it, they really cared about the result, and it actually shows that there's a significant IGV compression at the C1 level with collaterals and hemodynamic changes.
Okay, doctor. So what we need to do here exactly?
Well, the patient needs to have surgery. She needs surgical decompression here, which will include a styloidectomy, resection of styloid muscles, and C1 transverse process resection right here. So that will allow the jugular vein to expand. Obviously, there are lots of critical points here. For example, after C1 shaving or resection of the C1 transverse process or tubercle, then jugular vein may or may not expand.
Okay.
Because it's in this envelope called the carotid sheath, so it has to be opened. So there are lots of technical details here. There might be some muscles also narrowing it. So, but the core point is like these two bone structures, C1 transverse process
And styloid process
needs to be removed, and then the jugular should be decompressed.
One of them, it's not enough. Like styloidectomy, it's not enough. Yes,
well,
in this case.
It's always a question. All right. So that we hear this question all the time. I mean, should I do the one side and should I do both sides? Most people who deal with this problem, they actually do surgery on one side. But I know I'm not. I am usually, when I'm doing this type of surgery, I usually do surgery on both sides to maximize the effect of the decompression, because both of them, they are compressed. So with one there will be partial relief, but maybe not complete relief.
Yeah.
So, and why we should restrict ourselves to procedures that has a lower success ratio than the procedures that will give a higher success ratio.
Yes.
So it's a very low risk procedure, so we can do it on both sides and achieve perfect decompression.
Okay, doctor. Thank you.